Yeah, good morning, Dr. Nuhu. You are the immunization specialist of UNICEF. Could you please tell us how do mothers know when they should come up with their children for the next vaccination?
Well, when mothers are pregnant, they are supposed to be attending the antenatal clinic. For each pregnancy, we expect a mother to attend 4 times. During the antenatal clinic, the mothers undergo a session of health talks. During the health talks, the importance of immunization is explained to them and how it is going to affect their unborn babies and even after the babies are delivered. So from before delivery, the mothers are aware that their babies need to be immunized. Now after delivery, at birth, the child is given the first dose of immunization, and the mother is also issued with a card, an under 5 card. On this card, the first dose is documented, and she is told when to come for the next dose of the immunizations.
How does UNICEF convince mothers to bring their children for immunization?
Okay, in addition to the health talks that the mother will receive and the card which she has, UNICEF is also supporting the health education unit of the Ministry of Health to ensure continuous information about immunization. So this is done through usually posters for mothers who can read, and through jingles on TV and radio. We also have sessions of social mobilization through town criers, through street-to-street mobilizers, and we also talk to the religious leaders and traditional leaders about immunization so that they can communicate these messages during their interaction with the members of the population, especially mothers. In addition to this, UNICEF will also support the ministry through regular interaction with mothers at the community level, reminding them about the need for immunization through community health workers, faith-based organizations, and local NGOs.
How many children still need to be immunized in Sierra Leone, and how many has UNICEF already helped?
We did a coverage survey in the year 2010, and we have found that about 25% of our children, which is roughly 60,000 children, are still to be reached with full immunization packages. To this end, UNICEF and other partners agreed on a new strategy whereby during our child health weeks, where we go from house to house, we try to screen and identify children that are missed. This gives us an opportunity to meet the child at the home level, and this activity gives us opportunity to enter virtually every home in every location in the country. Through this, we were able to reach 14,000 children, but if you work the arithmetic, you will find out that we still have almost 46,000 children that we are not reaching, and we are trying to put together another strategy on how to identify where these children are, because that's our main problem, so that we can reach them in our subsequent child health weeks.
How does the day of UNICEF employee or volunteer look like? What are your biggest everyday troubles?
A very interesting place to work in UNICEF. It is very exciting. The day starts usually with anticipation of what is going to be again today. By the time you open, you get access to Lotus Notes, which is our email system. You are looking forward to what is the new thing. Now, what you get from the Lotus Note, from your mail, determines sometimes the mood of the day. Sometimes you can get something that requires a lot of urgency, which is usually the case. Actually, in UNICEF, there is never a dull moment. It is not uncommon to find staff running into each other along the corridors, running up and down, trying to fix things that would have come up. But despite this, sometimes it can also be very stressful. Stress can come because of pressure or conflicting demands or additional demands. Then sometimes it can be very exciting and challenging. It is exciting when you see results, when you hear that so number of children have been reached with certain interventions, key interventions that are cost-effective, evidence-based, life-saving interventions. So these are some of the excitements, but it's a mixed bag. Sometimes there's peace, calm and quiet, but suddenly you find that that peace is interjected by another emergency. Maybe for immunization, you can just get a call to say, oh, the cold chain system is broken down here in some remote corner of the country, or the vaccine stock is running low, or there is an outbreak of a disease here and there. But on the whole, it's an exciting time to work in an organization like UNICEF, where you have a satisfaction that you are touching somebody's life positively.
Thank you very much, Dr. Nuhu.
Thank you.